I'm worried about him. We needed to see forward progress here, didn't we?
A year ago, there were 3 patients on ITU with COVID. None were on ventilators. Today, there are 6. 4 of them sedated and being helped to breathe.
I think his breathing pattern looks really comfortable.
And
I think in lots of ways we've got to push him forward. So his x-rays are quite interesting. So this is a nice typical COVID x-ray.
The youngest patient here is a man in his late 20s with no underlying health issues, but he hadn't had the vaccine.
This gentleman's very unwell with COVID, and you can see that because what these areas here should all be black, not too dissimilar, black or grey from the colour here. This is about normal, but all this white fluffiness, and that's severe COVID pneumonitis. And he's not below extubate at the moment, but if we get things right, he's moving towards that.
The difference to last year is that there is now a vaccine. The pressure here, though, is coming from a certain group of people.
The COVID patients we've got on ITU are largely unvaccinated, so that's the real clincher, and that can be quite demoralising for us to see because we really are working at maximum. So when you see patients coming in, they haven't had their vaccines, and we're needing to do everything we can. So that's tough, and along with non-COVID stuff, that's all. We've got a lot of busy non-COVID ITU patients as well.
He's developed a blood clot in the lungs.
2 of the 6 patients here with COVID are double jabbed. Both of them are older with other health issues, and this patient is getting better.
You saw a younger gentleman, unvaccinated, not doing so well in terms of time it's taking him to get better, whereas this gentleman who's vaccinated, getting better quicker.
He's not on that much oxygen anymore, which means we can start to turn off the medicines which keep him in a coma and start to wake him up and get him breathing for himself again.
You're doing really well.
You're very safe.
It's a stark and sobering experience being back in intensive care again, but since I was here a year ago, there are fewer patients with COVID in the hospital overall, but there are more here in intensive care, and as we've heard, many of them are unvaccinated. As a result, the unit is at capacity once again, and that has knock-on effects for what else the hospital is trying to do.
Sometimes this COVID unit gets really, really full and we're putting extra bed spaces in and the nurses are having to share out patients, whereas it should be one-to-one.
Today we've just about got all the cases in we need to do, but we don't want to be just about. We want to have, more flexibility and be able to deliver the best. We worry when we're as busy as this that we aren't able to give people that best level of critical care that they need. As things stand, I don't think we have any beds. However, we have got dischargeable patients.
It's a fine balance at the moment, and winter pressures are just around the corner. Today, a COVID patient was discharged back to the ward, but was soon replaced by another. Nothing is changing.
Sometimes it's kind of strange seeing people here that are younger than me. Some people here are in their 20s, which is kind of scary for me to see, but then also they've not had their vaccines, so if everyone just gets their vaccines, then we can potentially get out of this.
I'm going to give you something for your breathing.
It's here that the difference between those that have and haven't had the vaccine is most apparent. And while so much has changed in society in the last year, in intensive care, it seems little has. Steve Knibbs, BBC Points West, Gloucester.